Hi, welcome to another Tuesday with Timeless. I'm Dr. Stefanie Christian. Today we're going to talk about maturing skin. What happens to skin as we age? What can we do to prevent premature aging of the skin? And how do we treat maturing skin? So it's natural for skin to age. It's a natural process. And we'll talk about that process from the outside in. So superficially, we see a number of things happen to the skin. We see pigmentary changes. It's not unusual to see brown spots develop, especially in those areas that are closest to windows. So the left side of the face is frequently a side where we see brown spots. When people golf, the hand that doesn't wear a golf glove often has brown spots. We see vessels, visible vessels, develop on the face, often on the nose and the cheeks. And we see fine lines develop. Fine lines are evidence that the face is developing a decrease in collagen, which gives skin its thickness, and a decrease in elastin, which gives skin its spring back. And as you have a decrease in those things, skin develops those fine lines. But the other thing that develops as that happens is passive creases. So skin is attached to muscle. And when we were 10, when the muscle contracted, the skin contracted and we got a little crease. But as soon as that muscle relaxed, the skin relaxed and it was very, very smooth. But over time, as we lose the collagen and the elastin, when the muscle contracts, we have that active crease, the crease that is there when the muscle underneath is actively contracting. But when that muscle relaxes, the skin doesn't fully relax, and we're left with what's called a passive crease. And it's often a time when people come in and say, can you do something about this? It makes me look older than I feel, and it makes me look cross. Because that happens in areas where we have repetitive motion. Often happens in the frown lines and the horizontal forehead creases and in the crow's feet. Deeper than that, we have volume loss, and we have loss of fat, we have loss of muscle, and we have loss of bone. And this tends to lead to deeper creases and hollows here and hollows here on the chin, and we have creases on the cheek, and we have hollows in the tear trough, and we lose the proper framing for the eyes, which gives the eyes in the upper face a youthful appearance, and we have a sort of a sunken look around the mouth. So that's what happens as the skin ages. What can we do to prevent the skin from prematurely aging? Well, if you've been with me on these Tuesdays, you know that I say the same thing over and over, that the skin is your biggest organ and you are what you eat. So I always recommend an anti-inflammatory diet, in particular, a low glycemic diet that is rich in fruits and raw and steamed vegetables. If you look through your cupboard, if you're an average American and you look through your cupboard and your refrigerator and your freezer, you're likely to see a lot of processed and refined foods. Chips, bread, crackers, cookies, pancake mix, frozen waffles, frozen French fries. Those are all things that have been processed. And so those are the kind of things that are not great for your body, but also not great for your skin because they cause a lot of inflammation. So when I talk about low glycemic, it's okay to eat carbs, but the kind of carbs I'm talking about are sweet potatoes and quinoa and brown or wild rice, corn. It's not a vegetable, it's a carb. Water, water, water. Best hydrator there is. Sunscreen. I always talk about sunscreen. Zinc-based and every day. It doesn't matter what season it is, and it doesn't matter whether you can see the sun or not. The UVA rays, which are the premature aging rays, get through clouds, they get through ozone, and they get through glass. So you've got to be wearing a zinc-based sunscreen every day. I like to have people on a regular skincare regimen. I like to recommend that people be doing regular exercise. It's great for the stress hormones. And that's the next point, which is stress management. People who've been in the practice have heard me say that you can't change the wind, but you can trim your sails. None of us can get rid of the stress in our lives, but we can change how we deal with stress. So perhaps the best way for any one of us to do that is to have a breathing technique that we use. So if you have a particularly difficult client, or you have a very micromanaging boss, or someone cuts you off in traffic, you employ that breathing technique, and that brings your blood pressure and your pulse down. You don't have to go somewhere, you don't have to change clothes, you don't have to go into an Om position. You do it right there on the spot, and it changes your physiology. So it actually changes your stress hormones, and it brings down your inflammation. It's not only really good for your skin, it's good for your heart, and it's good for your lungs, and it's good for your joints, and it helps prevent diabetes and lipid problems, et cetera, et cetera, et cetera. Because stress is just bad for us. Regular sleep. We read all the time about how important regular sleep is for us, but it's very easy to say, oh, I can't do that. Well, truly, the only people who can't do that are people who are shift workers and work third shift. It takes a lot of regimentation, but if we sleep regularly, meaning we go to bed at the same time and we wake up at the same time, it's really good for our biorhythm. And that in turn is really good for, once again, our stress hormones. And last but not least, for women, hormone regulation. The change in our skin after 50 or after when we have menopause is pretty significant, and a lot of that is linked to hormones. And so knowing what your hormones are doing and speaking to someone who is very skilled in managing hormones is a beneficial thing to do. We have learned a lot about hormones in the postmenopause, a lot more than what was thought when a poorly designed and poorly interpreted study happened in the early 2000s. So then how do we prevent premature aging? Well, a regular skincare regimen. How do we treat premature aging? A regular skin regimen. Now that really should be individualized. It's hard to be a consumer. Companies spend millions and millions of dollars on marketing. They know exactly what color a package should be, what font it should have, and they spend extra money to make sure that the package is just at eye level in the store. But that doesn't mean it's necessarily going to be good for your skin. So what's best is to have someone who's very knowledgeable about skin and skincare products look at your skin, listen to your concerns, evaluate what's going on with your skin, and then make recommendations specific to you. We have an esthetician who's absolutely marvelous at that. So I recommend having an appointment with her. I can tell you that there are certain things that should be in the regimen for most people. A good cleanser. And I can tell you that the Is Clinical Cleansing Complex is a good general cleanser. It's a gel cleanser, and so that's good for most people. If you have particularly dry skin, you might choose to have a cream cleanser instead, but for a lot of people, the Is Clinical Cleansing Complex is just an ideal cleanser. For most people after the age of 35, they should be on a retinoid. It does that cell renewal, cell turnover that you really start to need after 35 because your body is no longer shedding the dead keratinized squamous cells, and they start to accumulate on the skin. And that's why often after the age of 35, our skin doesn't glow anymore. The light doesn't reflect the same way. The skin starts to look dull. That means that we need to be doing that cell turnover. And retinoids do that. But if you choose the wrong retinoid, it's going to be too drying, and the skin will feel like it's cracking or like it's pulled too tight, and people won't use it frequently enough to get the benefit. So you have to know a little bit about the biochemistry and choose the right one. The nice thing about the one that we have and that we recommend is that it's soothing to the skin, not overly drying, because it has thermal spring water in it. And it also has vitamin E, which is antioxidant. So we recommend that at nighttime. It's really important, whatever retinoid you use, that it's always put on completely dry skin. A retinoid plus moisture will be super drying, and that's when you'll really get the cracking and the bleeding. You never want to do that. You won't get the cracking and the bleeding with the one we use, but you can get that with, say, Retin-A. So if you've got a little bit of dampness on your skin and you put Retin-A on that, you will get cracking. And so you have to have your skin completely dry. So maybe you wash your face, you pat it dry, and then you brush your teeth, and then you put your retinoid on. It's a really nice way of making sure that it's completely air dried. The next thing that we recommend for most people who are in the sort of mature skin age group is the Aven Antioxidant Defense Serum. It's wonderful. For one thing, it has hyaluronic acid in it, so it gives 24 hours of skin hydration and plumping. But it also has vitamin C and E precursors that are time released, so they're released throughout the day, and they provide a shield against the oxidative stress that you get throughout the day. So it's a really nice thing to do in addition to your sunscreen, because most sunscreens protect you. The good ones that we recommend with zinc are going to protect you against UVA and UVB, but you also need that protection against the environmental stressors, and that's what your oxidative protectors are. They protect you against the oxidative stressors in the day. And that's why you put on the AOX serum in the morning, and you put that on before your sunscreen, which is the next thing we recommend. I would say, off the top of my head, I would recommend one of the Elta sunscreens. There are a number of different formulations for different skin types: dry skin, normal skin or combination skin, oily skin, and they even have tinted, and it's not tinted enough that it's going to give you coverage, but just tinted enough so that if you have darker skin, you won't have that sort of a little bit of whiteness from the sunscreen. So that would be an average of something that you might recommend to someone who has maturing skin. And then if there are particular concerns, you might add in a product. For the treatment of pigment, IPL or Limelight is the gold standard. It's a light-based treatment that actually triggers the body to get rid of the damaged pigment-containing cells. Usually requires 2 or 3 or 4 treatments. I had so much sun damage from being a lifeguard and a competitive swimmer and a competitive tennis player that I needed 4 treatments, but I've been doing this procedure since 2006, and I've only had a handful of patients that have required 4 treatments. Most patients need 3, and occasionally I'll find someone who only needs 2. If you're not ready for a light-based treatment, chemical peels are a good option, but they only remove the pigment that's at the surface. They're not removing the damaged cells that are underneath, but they are a cosmetic way of dealing with the pigment that's on the surface. They won't actually eliminate the brown spots, but they will lighten them. For the IPL treatments, it's best to do them in the fall, maybe starting in October. For peels, you can really pretty much do those any time of the year. The other option are products containing hydroquinone and azelaic acid. Those are products that decrease the production of pigment. They only work as long as you're using the product, and they're really best used as pre-treatment for procedures or as part of multi-pronged approach for the treatment of melasma. For vessels, the best treatment is laser, hands down. Because we have such a large population of patients who have rosacea, we have 2 lasers that treat vessels, and we have one of the best lasers that's on the market. Hands down, the best way of truly treating and eliminating vessels. For fine lines, it depends on how bad the fine lines are. If it's just the beginnings of fine lines, then chemical peels combined with retinoids are a great way of starting. The chemical peels are going to get rid of those accumulated dead cells that are lying in the fine lines and making them look more prominent. And then the retinoid is going to help with the cell turnover so that you're building back healthier cells and healthier skin and better texture. And that's often just enough when you're just at the beginning of developing fine lines. If the lines are more generalized on the face, then an excellent option is fractional CO2. This is a procedure where we use the light from the laser to vaporize little holes in the skin, which are like little columns. The skin heals from the outside in and the bottom up with brand new skin cells that have brand new collagen and brand new elastin. It smooths the skin and it tightens the skin, and it's completely rejuvenating. And people often say that they look and feel about 8 years younger. Now, it turns back the hands of the clock, but it doesn't stop the clock. So whatever you're doing in terms of all those things I talked about, how you're eating, how you're hydrating your skin, how you're sleeping, how you're managing stress, the sunscreen, et cetera, et cetera, et cetera, will determine how the hands of the clock move forward. But it's a wonderful procedure for the vertical creases on the cheeks that are due to sun damage and the lines that have gotten a little worse than what we can manage with some other procedures. If the fine lines are getting a little more prominent, then laser genesis is a really good treatment. Laser genesis is a non-interventional, non-invasive laser. You leave looking pink and a little glowy. You start with a series of 5, and then depending on your age and depending on your skin condition, we determine how often you need them for maintenance. It's a lovely treatment. I particularly like getting them in the winter. It's a warm treatment, but not a hot treatment. And I'm a freeze baby, and I love getting it in the winter. For passive creases, those ones that happen here and across the forehead and the crow's feet, the only treatment there is injections, because there's no cream that you can put on the skin that's going to get down to the muscle, which is ultimately the cause of those passive creases. And so in this country, we have 3 injections. We have Botox, Dysport, and Xeomin. Worldwide, there are more, but we'll focus on the discussion of those. What those injections do is they temporarily block the release of the neurochemical that makes muscle fibers contract. It's temporary, and in order to maintain that benefit, you have to get that injection every 3 months. If you're really good about getting the injection every 3 months, for the average person, after 2 years of being really compliant with that, often they can space out the interval between injections a little bit, maybe to 3¼ months, maybe even to 3½ months. And for very few lucky people, maybe even more than that. But it's a matter of retraining the muscle fiber. So you really have to be good about doing every 3 months. There are some people who can't do that. People who have hyperthyroidism, people who smoke, runners, super exercisers. And what I mean by that are people who do CrossFit or Orange Theory or hot yoga regularly. They're simply hypermetabolic and they chew through it. And so they will never get beyond 3 months. So now we've covered the sort of more superficial things. What do we do for people who have lost volume? Fillers. We have dermal fillers, and we have a lot of different type of dermal fillers. So we have very, very thin dermal fillers that are great for tear troughs. We have slightly more cross-linked dermal fillers that are still soft, but have a little more substance to them, which are really good for the lips. My signature isn't huge Kardashian type lips, but I like to see a picture that someone brings me of what their lips looked like when they were, say, 20 or 25. It's important not to have a picture where you're smiling, because when we smile, our lips get pulled tight. And so I can't see the natural shape of the lips. So I prefer to see a picture where you're not smiling. Those are not usually our favorite pictures. I don't care what you look like in the picture. I just want to see what your lips look like, what their natural shape was, what their natural size was, because this is all about returning the natural volume to them. If you have lines coming into the lip and I tighten the lip edge, often that is enough to improve those lines, and I may not even have to inject into those lines. So there are all of these things that play hand in hand, and if I can see what your lips looked like before, I can give you very natural looking lips that looked like you. If we get even a little more cross-linked, then we can go into the deep areas of volume loss under the mouth. And we have some wonderful fillers that actually build collagen that are great for cheeks and great for the indentations that help make the jawline smoother. So we actually have a lot of things that we can do to help prevent premature aging of the skin, and that can help treat aging once it's happening in maturing skin. So I hope today helped. And as always, I welcome questions. If you have any questions or comments, please add them to the comment section under today's video. Have a wonderful week, and I look forward to seeing you next week.